Welcome to today's discussion on men's health, where we're tackling a topic that often goes unspoken but is incredibly important: retrograde ejaculation. Let me ask you this. Have you ever noticed something unusual during intimacy? Maybe a moment where you expected one outcome, but something completely different occurred. This could be your body's way of signaling a condition that many men don't even realize exists. Retrograde ejaculation is not something people often talk about, yet it's more common than you might think. It's a condition where, instead of exiting the body as expected, semen takes an unusual detour backward into the bladder. For some men, this can be a confusing and even distressing experience, especially if they're trying to conceive or are unsure about what's happening to their body. In this video, we'll break down everything you need to know. We'll explore what retrograde ejaculation is, what causes it, and how you can address it with confidence and clarity. By the end, you'll not only understand the condition but also have the tools to take the next steps, whether for yourself or to help someone you care about. So, stick with us, because understanding this condition is the first step to empowerment. Let's dive in. Let's begin by understanding exactly what happens during retrograde ejaculation. Normally, during ejaculation, semen follows a straightforward path. It travels outward through the urethra and exits the body. This process relies on a precise coordination of muscles, particularly the ones at the base of the bladder, which act like a valve. When these muscles close tightly, they prevent semen from entering the bladder and ensure it flows in the correct direction. But with retrograde ejaculation, this process is disrupted. The muscles at the base of the bladder, known as the bladder neck muscles, fail to close properly. Instead of exiting through the urethra, the semen takes a detour and flows backward into the bladder. This condition doesn't cause pain, but it can leave men puzzled, especially when they notice a lack of visible semen during orgasm or experience cloudy urine afterward. To visualize this, let's use an analogy. Imagine a river flowing toward the ocean. Normally, the current runs downstream, unobstructed. But now, picture a dam at the river's edge. Its job is to guide the water forward. If that dam breaks, the water starts flowing upstream, away from where it's supposed to go. Retrograde ejaculation is much like this. The broken dam is the bladder neck muscle, and the river flowing backward represents the semen moving into the bladder instead of exiting the body. This condition may sound unusual, but it's important to note that it isn't harmful to your health. However, it can affect fertility and raise questions about your body's functionality. To truly understand retrograde ejaculation, it's essential to look at the factors that can lead to this condition. While it might feel like it happens out of nowhere, there are several underlying causes that can disrupt the body's natural processes. Let's break them down into three main categories for clarity. 1. Medical conditions. Certain health conditions can interfere with the nerves and muscles responsible for ejaculation. For instance, diabetes is one of the most common culprits. Over time, poorly controlled diabetes can cause nerve damage, particularly to the autonomic nerves that control the bladder neck muscles. Without proper nerve signals, these muscles may fail to close, leading to retrograde ejaculation. Similarly, neurological disorders like multiple sclerosis can disrupt the coordination of muscle movements, causing semen to flow backward into the bladder. 2. Medications. Another significant factor is medication. Many drugs designed to manage conditions like high blood pressure or mental health issues can have unintended side effects. For example, alpha blockers, which are often prescribed for hypertension or prostate issues, work by relaxing the muscles in the body. While this relaxation helps lower blood pressure or ease urinary flow, it can also cause the bladder neck muscles to stay open during ejaculation, allowing semen to flow backward. Medications for depression or anxiety can have similar effects by altering nerve signaling. Lastly, certain surgeries can directly impact the structures involved in ejaculation. Procedures on the prostate, bladder, or surrounding areas, such as prostatectomy, removal of the prostate gland, or bladder surgery, can sometimes damage or weaken the bladder neck muscles. Even minimally invasive surgeries may occasionally interfere with the muscle's ability to close properly. While these procedures are often necessary to treat serious health conditions, retrograde ejaculation can sometimes be an unintended consequence. These causes may seem diverse, but they all share a common thread. They disrupt the finely tuned process that allows ejaculation to occur as expected. Whether it's due to nerve damage, medication side effects, or surgical intervention, retrograde ejaculation is often a byproduct of addressing other health concerns. It's worth noting that this condition is not uncommon, especially among men with a history of diabetes, prostate issues, or those on specific medications. If you suspect that one of these factors might be affecting you, don't worry, solutions are available. Let's talk about how you might recognize retrograde ejaculation. The most noticeable sign is something called a dry orgasm. This happens when you reach orgasm, but there's little to no semen visible during ejaculation. It can feel confusing or even concerning, especially if you're used to things working differently. Many men describe it as an anticlimactic experience, where the usual physical result just isn't there. Another symptom to watch for is cloudy urine after ejaculation. Why? Because the semen that flows backward into the bladder mixes with the urine. So, when you urinate afterward, that cloudiness is a visible sign that retrograde ejaculation may be happening. These signs can be subtle, and because they don't typically cause pain or discomfort, many men overlook them or assume it's just a temporary issue. But if these symptoms persist, it's worth seeking a medical evaluation. How is retrograde ejaculation diagnosed? Diagnosing retrograde ejaculation is straightforward. Your doctor will likely start by asking about your symptoms and medical history, as this provides valuable clues. If retrograde ejaculation is suspected, the next step is a simple urine test. Here's how it works. After asking you to ejaculate, your doctor will test your urine for the presence of sperm. If sperm is found in the urine, it confirms that semen is traveling backward into the bladder instead of exiting the body. This test is quick, painless, and provides clear answers. And once you have a diagnosis, you can start exploring the treatment options that are right for you. Retrograde ejaculation might seem like just a small change in how your body works, but understanding the symptoms and seeking a diagnosis can make a world of difference. Whether it's affecting your fertility or just leaving you with unanswered questions, getting clarity is empowering. Retrograde ejaculation is more than just a physical condition. It can have a profound impact on different aspects of life, from emotional well-being to personal relationships and fertility. Let's explore how this condition might affect you or someone you know. Physical effects. From a purely physical standpoint, retrograde ejaculation doesn't usually harm your overall health. It doesn't cause pain, and it doesn't interfere with your ability to experience pleasure during intimacy. However, it does have one significant implication: fertility. For men who are trying to start a family, retrograde ejaculation can present a challenge. Since the semen doesn't exit the body as it should, natural conception may become difficult or even impossible without medical intervention. This can be frustrating and disheartening, especially if you've been planning to expand your family. Emotional impact. The emotional effects of retrograde ejaculation can often be more challenging than the physical ones. Many men feel confused or embarrassed when they notice changes in their body, particularly during such an intimate moment. If left unaddressed, this can lead to feelings of frustration, anxiety, or even shame. For men trying to conceive, the condition can bring an additional layer of emotional strain. Fertility struggles often feel deeply personal, and dealing with retrograde ejaculation can amplify feelings of inadequacy or worry about the future. It's important to remember that this condition is not a reflection of your masculinity or worth. It's simply a medical issue that can be addressed. Impact on relationships. Retrograde ejaculation can also affect relationships, particularly when it comes to communication and intimacy. Some men might feel hesitant to talk about the condition with their partner, fearing judgment or misunderstanding. However, openness and honesty are crucial. Many partners are understanding and supportive when they're given the chance to learn about the condition and what it means. While retrograde ejaculation is often treatable, its emotional and relational impacts can be overlooked if the condition is ignored. Seeking medical advice and support early on can help you navigate these challenges with confidence. Whether it's improving fertility, easing emotional strain, or strengthening your relationships, addressing the condition is an essential step toward improving your quality of life. The good news about retrograde ejaculation is that it's often manageable. While it might feel overwhelming at first, there are several treatment options that can help address the condition, whether your goal is to improve fertility, manage symptoms, or both. Let's explore the possibilities together. 1. Medications for many men, medications can be an effective solution. Certain drugs, like pseudoephedrine or other similar stimulants, work by tightening the muscles at the bladder neck. This helps prevent semen from flowing backward into the bladder during ejaculation. These medications are often prescribed after a proper diagnosis, and they can be particularly helpful for those who experience the condition due to nerve-related issues. It's important to note that medication effectiveness may vary from person to person, and it's always best to discuss options with a healthcare provider to ensure safety and effectiveness. 2. Managing underlying conditions. If retrograde ejaculation is linked to an underlying condition, such as diabetes or nerve damage, addressing the root cause can significantly improve symptoms. For example, better blood sugar control in diabetes can reduce nerve damage and improve muscle coordination. Working closely with your doctor to manage chronic conditions can be a game changer for your overall health and specific symptoms like retrograde ejaculation. 3. Assisted reproductive techniques, ART. For men who are focused on starting a family, assisted reproductive techniques can provide a path forward. In these cases, doctors can retrieve sperm from the urine after ejaculation and use it for procedures like intrauterine insemination, IUI, or in vitro fertilization, IVF. These methods allow couples to overcome the fertility challenges posed by retrograde ejaculation and achieve their dream of parenthood. 4. Surgical options. In rare cases, if retrograde ejaculation is caused by structural damage from surgery or other physical issues, a surgical solution may be recommended. While this is less common, it's reassuring to know that there are options even in more complex situations. The key takeaway here is that retrograde ejaculation doesn't have to control your life. With the right approach, whether it's medications, managing underlying conditions, or exploring reproductive options, there's almost always a solution that fits your needs. If you're experiencing symptoms, don't hesitate to reach out to a healthcare professional. The sooner you take action, the sooner you can regain confidence and take charge of your health. Now that we've covered the causes, symptoms, and treatments, let's clear up some common misconceptions about retrograde ejaculation. It's easy for myths and misunderstandings to spread, especially when it comes to sensitive topics like male health. Let's address a few of these myths and set the record straight. 1. Retrograde ejaculation is dangerous. One of the most common myths surrounding retrograde ejaculation is the belief that it's harmful to your body. In reality, retrograde ejaculation is generally not dangerous. While it can cause some frustration and may affect fertility, it doesn't harm your overall health. The semen that goes into the bladder is eventually expelled when you urinate, and the body can handle it without issue. So, while it may feel unusual or uncomfortable, it doesn't pose a serious health risk. 2. Retrograde ejaculation means you can't have children. Another myth is that retrograde ejaculation automatically means infertility. While it does complicate the process of natural conception, it doesn't mean that you can't become a parent. As we discussed earlier, assisted reproductive techniques like IUI or IVF can help men with retrograde ejaculation father children. So, if fertility is a concern, there are still options available to achieve parenthood. 3. Retrograde ejaculation is the same as erectile dysfunction. It's also important to clear up the confusion between retrograde ejaculation and erectile dysfunction. Although they both involve sexual health, they're not the same condition. Erectile dysfunction refers to the inability to achieve or maintain an erection, while retrograde ejaculation involves the semen flowing backward into the bladder instead of exiting the body. While the two conditions can sometimes occur together, especially if there are underlying health issues such as nerve damage or medications affecting both processes, they are distinct. If you're experiencing issues with either condition, it's important to talk to a healthcare provider to pinpoint the cause and get the proper treatment. 4. Retrograde ejaculation only happens in older men. You might also hear that retrograde ejaculation only affects older men, but that's a myth as well. While it's true that certain age-related conditions, such as prostate issues, can contribute to the condition, retrograde ejaculation can happen at any age. It may be triggered by factors like surgeries, medications, or health conditions such as diabetes, which can affect men at various stages of life. It's essential to separate fact from fiction when it comes to retrograde ejaculation. Understanding the truth can help reduce unnecessary stress and encourage men to seek the right help when they need it. This condition is manageable, and there are plenty of resources available to support those affected by it. We've covered a lot of ground today, from understanding retrograde ejaculation to addressing the myths surrounding it and exploring the various treatment options. Now, let's bring it all together with a clear and reassuring message. If you're experiencing any of the symptoms we've discussed, don't hesitate to seek medical advice. It's completely normal to feel uncertain or embarrassed when something changes with your body, especially when it comes to intimate health. But the most important thing to remember is that retrograde ejaculation is treatable, and the sooner you take action, the sooner you can begin to address the issue. A healthcare provider can help you get a proper diagnosis and guide you through the next steps. Whether it's a simple prescription for medication, managing an underlying health condition, or exploring fertility options, taking that first step toward understanding what's going on with your body is the best decision you can make. Don't let stigma or confusion stop you from getting the help you need. Retrograde ejaculation is just one of many conditions that can affect men's health, and talking to a doctor about it is nothing to be ashamed of. The more you know, the more empowered you'll feel to make decisions that improve your health and well-being. If you've been affected by retrograde ejaculation or have any questions about the condition, feel free to share your thoughts or experiences in the comments below. This is a safe space where we can have open conversations about men's health without judgment. Your voice matters, and your questions can help others who might be going through the same thing. If this video has helped you understand more about retrograde ejaculation, please consider liking and subscribing. We're here to continue breaking the stigma around men's health topics, and your support goes a long way in helping us do that. Together, we can create a community where everyone feels comfortable addressing their health concerns and seeking the support they need. Retrograde ejaculation might seem intimidating at first, but with the right information and medical support, it's something that can be managed effectively. Remember, you are not alone, and there is always help available. Thank you for listening today. We hope this video has given you a clearer understanding of retrograde ejaculation and the many ways it can be managed. Don't let fear or confusion hold you back from seeking help. Your health is worth it. Please consider subscribing and share your thoughts or questions in the comments below. We're here to continue breaking down the stigma around men's health, and your voice plays a big part in that. Stay informed, stay healthy, and take care of yourself. We'll see you in the next video.